Infectious Diseases Institute. I'm here with my colleague, Mike Nsuhuga, and we're here to present to you a project that we've been working on, where we basically used virtual reality technology for training PPE usage during the COVID-19 health emergency. Next slide, please. So COVID-19 has caused over 1 million deaths globally, and this has not only caused a threat to patients, but to also health workers. So we thought that there was need for us to train health workers in proper infection prevention and control practices like correct use of PPE. However, because of the highly infectious nature of COVID-19 and the strict social distancing requirements, the existing health worker model, which is the traditional classroom setting, faced a number of challenges. For example, it would not allow for enough social distancing, and even if we had this social distancing, would need much space for a large number of health workers to be trained. Next slide, please. So we came up with an innovative solution, which is virtual reality, and we thought that would teach our health workers on the correct use of personal protective equipment using this technology. So virtual reality essentially just uses computer technology to create a simulated environment. And this simulated environment can be a hospital ward, it can be the PPE itself. And this technology has several benefits. The first benefit is that health workers can be able to practice under hazardous conditions. In this sense, health workers can be able to practice in a simulated environment where they are safe until they are really confident of their skills, and then we let them out into the real life where they can treat COVID-19 patients. Also, the learners can be able to learn in different geographical areas because this technology can be delivered through the web. It also improves knowledge and retention because it's a technology that is based more on experience. And we all know that for the quality of learning, it always improves as we keep on practicing. So it also reduces the cost of training because we do not use actual PPE, we use 3D models and then later finally let them be able to use PPE when they get into the final, into the real environment. Next slide, please. So the way we were able to develop this project, we had to first use a curriculum. And this curriculum was adapted from the original Ministry of Health IPC curriculum. We tailor-made it specifically for virtual reality, and it was a framework on which we were able to create the modules. These modules were later translated into virtual reality, and later we did a pilot training of these developed VR modules with some select health workers, and these health workers came from different parts of Kampala. Some were KCCA health workers, others were from police, and some were from IDI. Next slide, please. So within this technology, we're also able to assess the participants. And we recorded their results. So as you can see on the left, the participants were able to perform relatively highly, where the most number of people got 95%, and were also able to compare their performance with the classroom model, where, as you can see, their performance in virtual reality is much better compared to that one of classroom. Next slide, please. So I'm going to let my colleague be able to show you the demo for now. The demo, please.
Yeah, it's coming in 1 second.
Don the gown by placing arms in the sleeves so they reach the ends of your wrists. Ensure the gown is covering from your neck to your knees. Tie the gown tight at the back of your neck and the back of your waist. Don the mask by covering both your nose and your chin. Pinch the nose bridge to fit it snugly on your face. Secure the bands at the back of your head and neck. Ensure they are not covering your ears. Don the face shield by securing it over your face and eyes. Don the gloves by placing them on your hands and extending them over the wrists of the gown.
Doffing of personal protective equipment. For the gown, pull the gown until the velcro at the neck comes undone, or untie the strips at the neck and the back.
All right, back to you, Grace.
Yeah, so what you were seeing was someone in the virtual reality environment, and they were able to put on the respective PPE. And sorry, the video was lagging, but that was just the demo. So so our next steps are to develop custom platforms appropriate for local needs, and would also like to enhance the VR lab with additional accessories. And we're also looking forward to collaborate with different interested partners. Next slide, please. So this is our team, and you can see that our team is comes from different fields. We have senior IT specialists, we have microbiologists, doctors, and also e-learning specialists. So the last thing that I would like to say is that so most of the time I had most people saying something about the cost of production and also sustainability. So when when the health workers know where to place which kind of PPE, in this case of there's PPE that's reusable and PPE that's not reusable.